Good morning and welcome to today's webinar, episode 3 of Virtual Reality in Medical and Health Sector. My name is Mohammed Imran and I'll be your host for today's session. So, we are all afraid of at least something in our day-to-day life, like fear of the dark alleys, fear of heights. Uh, but these kind of fears are controllable and can easily be overcome with a little bit of self-confidence and support. But what if these fears are not little anymore? So what if these fears are intensified and will mentally starts to affect you? So this condition is called as phobia. So what is a phobia? So you can consider phobia as an anxiety disorder, and it can be like defined by the persistence and excessive fear. It could be of an object or it could be of an situation. So phobias like typically results in rapid onset of fear and usually are present in more of time period of more than 6 months. So phobias can have a significant impact on individual's life and it can be challenging to treat using the traditional methods. So what were the traditional methods while treating the phobias? It was a method where you were introduced to the fear which you have the phobia of, and letting you gradually get habituated to the situation. But most of the time it was not possible because there are so many different types of phobias, and the traditional method was not uh, that easy and it was risk worth. So fortunately, virtual reality and augmented reality offers an very exciting and new possibilities in treatment of the phobias. So in this webinar, we will be exploring the use of virtual reality and augmented reality in treating various phobias and how these technologies are revolutionizing the way we overcome the fear. So, as the title suggests, the virtual reality and augmented reality in phobias. So, what are the innovative approaches to overcome the fear? So, before that, let's understand uh, what is phobia. So, you can define this condition as like an extreme or irrational fear of specific object or situation due to anxiety. This is also a type of anxiety disorder and can cause significant distress and not just distress, disruption, and also to which will be affecting your day-to-day life. So when coming to the specifications of the phobias, there are three types of phobias: specific phobias, social phobias, and agoraphobias. So when it comes to specific phobias, sorry. So when it comes to specific phobias, which are like the fear of specific objects or specific situations, for example, you can consider spiders or being in predefinite heights or like flying. So these can be defined as specific phobias, whereas social phobias, and this phobias involves the fear and anxiety of social situations such as public gathering or meeting new people or eating in public places. Whereas agoraphobia is different when compared to specific phobias and social phobias, because this is the fear of the situation where escape may be difficult or help may not be available, such as in a crowded place or a place where you have been stuck due to some incidents. So how do you identify that you have phobia or like any disorders regarding the phobia or the anxiety disorders? So what could be the symptoms? So the symptoms of phobia can vary depending on the individuals and the type of phobia they are posing. So, but most of the phobias will be having some common symptoms. This includes intense fear or anxiety in the presence of that particular object or the situation. So the people with these phobias tend to avoid these objects or the situations at an extreme mode. So, and the physical symptoms will be like sweating, rapid heartbeat, and trembling or shortness of breathing, might be having panic attacks, and you will be feeling that you're out of control. So these are the traits which can be helpful to recognize that it's not just some common fear, it could be persistently a phobia which you are suffering from. So now that we know that what are the phobias, so let's also discuss like what are the common causes of phobias. There are like different situations where you tend to be affected by the phobia. Uh, so there are like various factors. It could be traumatic experience or exposure to the object or to a situation where you have been faced with intense fear, and because of the learning behavior too. Um, as you might have experienced that snakes are dangerous for the people, and some people have intense fear for snakes, cockroaches, and lizards. These are from the learning behavior, because from childhood itself you have created a fear for these objects and these situations. That's why you will be tending to have a phobia by the end of the day. And it could be genetic or family history of anxiety disorders. There could be also brain chemical disorders, so stressful life events or chronic situations. These are all the common causes of phobias. So before we get into understanding how virtual reality helps in treatment of phobias, let's also have a small briefing about what are the different types of phobias and their existence. So fear of flying. So this is a phobia, specific phobia, which can be involving like intense fear of flying on planes. So people with this phobia may experience anxiety and panic attacks before and during the flight, so leading to avoidance of traveling through the flights. It might have been like very clear from few of the case studies that people are scared of flying through airplanes. And the possible solution for this, which was previously used, the traditional method, was hypnotherapy, where the patient was hypnotized and was constantly given feedbacks to subconscious mind that flying in planes is safe and there is nothing to be fear of. Most of the cases, this is not 100% solution to overcome this fear. And similar to this fear, there's one more, which is fear of heights, and it's known as acrophobia. This specific fear involves like intense fear of heights and high places. So people with this fear will feel dizzy or experience physical symptoms such as sweating, trembling, shortness of breath when they are exposed to such height conditions. So one of very common fears which are very widely available throughout the world is fear of the spiders. And this specific phobia involves intense fear of spiders or arachnids. Arachnids are like the living organisms which comes under the the spider category. Okay. And this is known as like so the fear of spiders is called as arachnophobia. Here you'll be having the fear of insects, arachnids, the eight-legged insects, and these phobias are very intense and could affect your day-to-day life. So these are like the objective of the specific phobias. When it comes to like other phobias, which are the social phobias, like you will be having fear of public speaking. So this is a social phobia that involves an intense fear of speaking in front of large group of people, or like when you are intend to meet new people or experiencing the public events. So people with this phobia will be experiencing anxiety and panic attacks. It could be happening during or before the public speaking events, and this will lead to the people who are suffering with the fear of public speaking to avoid these situations. And there's one more interesting phobia which has been not been discovered lately, but is widely spread, which is the fear of enclosed spaces. So there was a case study where a patient was having fear of the staircase, because the staircase was very narrow and small. So he had this fear of getting on the steps and going upwards. This is not the fear of heights. This is the fear of enclosed spaces. For example, if the patient with fear of these enclosed spaces are put in a small place, so they will be having intense anxiety attacks because of this, and this is called as the claustrophobia. So this specific phobia involves intense fear of being in enclosed spaces or confined spaces. It could be elevators, it could be small rooms, it could be tunnels. So people with this phobia may feel trapped or suffocated and panic, and these are the life-threatening risks involved with this kind of phobia. So people with this phobia will tend to avoid these situations and will try to stay in a safe organization when it comes to addressing these fears. So I'll also be discussing few interesting phobias. Before we get into that, let's discuss how virtual reality and augmented reality can be helpful in treating the phobias. As we have discussed the acrophobia, the fear of heights, the virtual reality can create a simulated and safe controlled environment where the person who's suffering from acrophobia can be put in a situation where he has to face his fear of heights level by level. This will be uh, constantly and slowly increasing the confidence, and this therapy is way too effective when it comes to treating the phobia with heights. So there is one more interesting phobia which I think I was also a part of when I was a kid, but not anymore. It is called as the fear of needles. So the name is a bit complex here. The trynophobia. This phobia involves intense fear of like needles, injections. So here, augmented reality or virtual reality can be used to simulate virtual environment where patients can practice coping with these strategies, and exposing themselves to these therapies will gradually reduce their fear and the anxiety levels related to the fear of the needles. So not just the fear of the needles when it comes to medical procedures, there is also fear of dental procedures, also known as dentophobia. There is another name for this, odontophobia, and this fear involves of like dental procedures such as teeth cleaning or teeth filling. So augmented reality and virtual reality again can be used to simulate the environment, and where patients can undergo a step-by-step therapy, which will be gradually helpful for them to decreasing the fear of dental procedures. So not just the dental procedures and not just the needles, but there is also fear for medical procedures. So this is called as the latrophobia. Yes, there are a lot of phobias out there in our present society. So yes, so latrophobia is a phobia where you have fear for medical procedures. It could be surgery or blood test. So again, augmented reality can be used to simulate a virtual environment where patients can practice coping with these strategies and exposing therapy, and this will be gradually reducing the fear and the anxiety related to these medical procedures. So, what are the advantages of VR and AR in phobia treatment? First of all, I would like to say that VR and AR will be providing phobia, right? Sorry, I forgot to change the slide here. So, anthrophobia, the phobia of where you are have the fear of public speaking. So once if we come back to the use of virtual reality in arachnophobia, as you can see, the patient is in a virtual reality environment where she is facing her fear of spiders. Here, the patient is uh, placed in a virtual environment where spiders from small size to bigger size will slowly, gradually be placed on the patient's hand or near to the surroundings of the patients, explaining them at the same time that there's nothing to be scared of it, gradually building their confidence. So this is how virtual reality will be helpful in treatment of arachnophobia. If we consider the traditional method where real spiders were used, and not just real spiders, but realistic models of spiders were used, patients were affected with high anxiety attacks. So that's why virtual reality is way more beneficial when compared to the traditional methods of treating arachnophobia. And when it comes to like acrophobia, the fear of heights, as you can see, the patient is on a plank walking at heights. So this is not the initial stage, but the initial stage starts with a lesser height where the user has to cross each level to face their fears. So this is a very controlled environment, and not putting the patients at risk or not putting them in an anxiety state, and also helping them at the same time, where these states and these levels can be adjusted based on that the level of fear they have for that. So for example, if the acrophobia is at high intense level, it will be starting with level 1, level 2, level 3, gradually increasing to the highest level, and possibly showing a positive impact on patients with acrophobia. And anthrophobia, This is the phobia where you will be having anxiety attacks and fear of public speaking. It could be public event, it could be a public gathering, or it could be public speaking event. So where you have the phobia of speaking in front of people. So virtual reality creates an environment, uh, and again, this is also a level-based treatment procedure where the user is put in a situation where he has to uh, complete tasks in front of a group of virtually generated people. So the level starts with a general conversation between a virtual avatar as a level one, and gradually increasing to a public speaking level, where once the user completes each level, he will be rewarded with the benefit of the audience applauding, and which will be gradually increasing the confidence of the user, and the decrease of fear with the phobia of anthrophobia. So this will be a very helpful situation, and a very cost-effective situation, because for the people who are suffering with anthrophobia, it's not possible for them to create the same scenarios again and again, and it will be a costly procedure. Whereas in virtual reality, it can be adjusted depending on the conditions of the people who are suffering with anthrophobia, and the level can be adjusted, and it can be a repetitive process. So this is a very cost effective and a repetitive process, and the progress of the patients can be tracked at the same time. So this will be suggesting the doctors at what level the patients has to be taken to the next, and how the treatment procedures is going on. So this is a very positive impact on the treatment of phobias. So what are the other benefits of virtual reality in treatment of phobias? So enhanced patients engagement. As you can see, I have given you a few examples of how these virtual reality environments will be helpful in enhancing the virtual environments. So VR and AR will be providing a highly interactive and immersive therapy experience. This will be increasing the patient's engagement, and this will also be increasing the motivation of the patients, and they can actively participate in therapy rather than just listening to the therapist. So this can lead to a better treatment outcomes. So what is the next benefit of virtual reality in anthrophobia or arachnophobia or acrophobia, or what are the other different types of phobias the patients are facing through, is realistic simulations. So virtual reality and augmented reality can create highly realistic simulations of phobias and the situations, such as flying on a plane or being in a on a dental chair. So this will be allowing the patients to confront their fears in a safe and controlled environment, and this indeed will be leading to more effective and exposure of the therapy. So one more important factor which we have to consider as the benefit of virtual reality is reduced anxiety, because VR and AR creates a virtual simulation. Patients can feel less anxious and more in control of the therapy. So this will be gradually reducing the intensity of anxiety and the panic symptoms. So this will be making it easier for the patients to confront and confront and overcome their fears. Last but not least, as I have previously said, safe and controlled environment. So VR and AR will be providing a safe and controlled environment where patients can confront their fears without the risk of harm. As I said, acrophobia is a fear of heights, and making the patients to be in a situation at height situations, this may risk them due to the anxiety attacks. But in virtual reality, as it's a safe and controlled environment, the user can repeat the process as many times as possible to make him comfortable, and this is only possible via virtual reality and augmented reality. So this is especially very important for phobias that involves potentially dangerous situations, such as having arachnids or the spiders in your hand or in your surroundings, rather than holding a digital generated 3D model of spider in your hand. So the other situations could be like flying or the heights. So there are several case studies where virtual reality and augmented reality has been used to treat phobias. So I would like to have a small word with, just give me 1 second, please. So I would like to have a word with the audience regarding the topic which we have discussed, and the efficiency and the effectiveness of virtual reality and augmented reality in phobias and treatment. So if you have any doubts and concerns regarding this topic, please drop a message in the Q&A, and I'll be more than happy to answer the questions. Well, it seems there are no questions for at the moment, and so I'll continue with few more things to explain. So, as I have previously said at the beginning of the webinar, my name is Mohammed Imran, and I'm working as project manager in Devdin Creative Solutions. So, we at Devdin Creative Solutions are constantly working in this developing technology of virtual reality and augmented reality, and we have created a number of applications, not just in the medical sector but also industrial sectors. So, we have previously worked with creation of applications where therapies are involved, phobias are considered as a main factor. So again, we'll be meeting in the episode 4 of virtual reality in health and medical sector. Thank you for joining, and I hope you have a very fantastic day ahead. Please make sure to join for episode 5 and have a great day. Thank you.